And now we're going to pivot. That's an inside joke for anybody who gets that. We're going to pivot to the nobody gets that joke. We're gonna pivot to the to go back to the action beats part of the program, where we're going to hear some again some amazing announcements. The first one is going to be presented by Dave Whitlinger. Dave is the executive director of the New York eHealth Collaborative, and he will be making an announcement. Here we are, Dave. Welcome. Come on.
Good morning. Let's see. Click. We're having an IT moment. Click. Advance the slide, please. There we go. All right. Hi. I'm the executive director of the New York eHealth Collaborative. The New York eHealth Collaborative is a public-private partnership. We were formed in 2006 in partnership with the Department of Health, and the leadership of New York was forethinking back then about the investment in healthcare IT. There was a little bit of good conversation in the healthcare leadership back then about healthcare reform is on the horizon. We know that this is going to require us to be more efficient as a care delivery system. Let's start getting invested in healthcare IT. And thankfully at that time, the leadership was able to summon up some resources and start building health information exchanges around the state. So there were 12 health information exchanges developed around the state at that time, and those organizations worked within those communities to start connecting up clinical data. And if you can imagine back in that time frame, a lot of the clinical data that was available was predominantly with hospitals and labs. You know, most of primary care and specialty care hadn't seen or heard of meaningful use yet. Adoption in those ranks was fairly low. So those organizations get started in connecting up the clinical record base. Now, of course, fast forward a couple of years, the NICE organization, New York eHealth Collaborative, is one of the 2 regional extension centers for the state in partnership with the New York City REACH program. We're responsible for over 10,000 doctors getting up to meaningful use, and mostly in the primary care setting, of course. And so we're rapidly trying to catch that part of the market segment up to the usage of electronic health records. And ultimately, the goal here is to get everybody connected to what we affectionately call the SHINY, the State Health Information Network of New York. And this we expect to be the network that really represents the clinical repository, the clinical network for all of the patient records across the state. So the NICE organization, the New York eHealth Collaborative, is now actively working with those 12 regional extension, or those 12 RIOs, or health information exchanges, to get all of the clinical care connected up to the network. That then creates a great opportunity as a platform that I want to talk to you how we now are looking to leverage. The other thing that is interesting to note, because of that work that's gone on, we're now somewhere around 70–80% of the hospitals in New York are connected, and we're chasing that number, of course, with the primary care work that we're doing. So in that time frame, of course, all this great work is going on with the anticipation of healthcare reform, and lo and behold, here comes healthcare reform. Healthcare reform really took hold last year in the state of New York as Medicaid really was staring at a significant budget deficit and said we have to get collectively together on how to control costs here. And so that manifested itself in what is known as the Medicaid Health Home Program. Medicaid has said that they are now on a track to completely eliminate fee-for-service in the state of New York within 2 years, and the Health Home program is really designed to do that. And this year, 20 health homes were initiated. Those are collections of providers. So think of a large healthcare institution and all of the provider network around that institution that might be needed to provide very very broad and holistic care around a given patient. And those patients, these are the sickest of the sick. These are the highest utilization patients in the Medicaid ranks. A couple million patients are now being assigned to those health homes, and those health homes are saying, this is where we now need help. They're very similar, as you can imagine, to ACOs that have started to form, and the consistency with that need to coordinate care. So last fall, we started meeting with these health homes. We got several hundred clinicians in a room, and we said, okay, we think that this statewide network that we're putting together is going to have value to you as you now start to try to coordinate care across your different healthcare provider institutions. But we're not sure whether or not you have the right tools. It seems like an EHR that's really designed with a workflow in mind of a single patient, single provider encounter isn't going to provide you with the workflow that you need to really coordinate across these different provider institutions that are different businesses, different locations, and different EHR products. There's something missing here. And they said, absolutely. And we went through a requirements gathering process over a couple of months with those organizations in order to figure out what was missing in the healthcare IT sector that they needed in order to be successful. Those innovations are, you see there on the right. Care coordination, and this is the idea of many different clinicians all trying to address the same patient, and they need one care plan. They need one place where they coordinate the care plan for that individual so that they're not stepping on each other, so that they're able to commonly share data about the patient, and that they're truly able to coordinate the care across those physicians and be a much more efficient way of doing that, better outcomes, better cost. Analytics, this is the ability for those physicians to be able to look into their panel of patients and proactively pull out reports that say, I need to go address these hotspot patients before they become acute and become a problem, not only adverse for the patient, but also for this care coordination mechanism that we're trying to put together. Physician alerts. This is the ability for the system. This is this broad network that now in real time is collecting clinical data so it knows when a patient encounter occurs. How do you send an alert to the care management or care coordinator such that if that patient presents themselves into the ER or another care setting that they weren't expecting, that care coordination team can perhaps intercede before that patient goes through a costly and unnecessary workup in the wrong care setting. And patient engagement, of course, this is where every clinician that we spoke to said, this is where we really feel the sweet spot is. If we could really get patients engaged in their own care, get them really engaged in their own care plan, we can really bend the curve here with care delivery. The frustration level, of course, with physicians where they would say we really are lacking in our ability to have patients understand how much their participation in their care plan affects their outcomes. And so the tools that we saw that could potentially be game-changing here are across these four vectors. So we sat back and we said, wow, we got a network here that's building up clinical information. All the clinicians are getting engaged with it. This is great. We have payment reform now that is really driving to the right model of care delivery. And we have this gap in tools. We need these software tools. Fortunately, my office sits in the middle of Wall Street for some other reason, but we're sitting there in the middle of Wall Street. We said, let's see if we can tap the investment community in order to help us create innovation on top of our network in order to provide these tools, thereby stimulating a new growth sector and really giving us the tools that we need to solve some healthcare problems. So we put together the idea of if we can expose a set of APIs on the Shiny network such that application developers would have the ability to build applications against this where they could get the clinical information out, personalized data, real patient data, but it also embodies the state policies with regards to privacy, use, data security. So there's a wall there that the programmatic interfaces adhere to, and those applications thereby have to adhere to. Then we can create innovation on top of this. And if we add to that a set of funds, then we have an ability to put together a program. So we partnered up with the New York City Investment Fund the Department of Health in the state of New York, great support from Governor Cuomo, Commissioner Shaw, in putting this innovation together such that it sits very strongly in concert with the Medicaid Health Home Program. We said, let's go accelerate. We teamed up with those communities, gathered together 20 of these health home provider organizations, name brand healthcare providers, which I'll show you in a moment, as well as name brand venture capital organizations that really said, we want to help this be a successful program in the state of New York for the purposes of helping healthcare, but we also want front row seats to see those innovative companies that might materialize here that we can invest in and substantially take this nationally. So our program that we put together is called the Accelerator. It launched a couple of months back, and we've had a call for companies open here that we closed on Friday. The program is really designed to pair those companies up with those healthcare providers and give them finances in order to accelerate their product that meets those 4 vectors over the course of 9 months. So as a company that enters this program, they have the ability to work shoulder to shoulder with those healthcare providers that are really trying to do care coordination, patient engagement, receive alerts, and be able to manage the analytics. They're sitting shoulder to shoulder and getting firsthand feedback on their products in order to help them succeed. We're providing that mentorship. We're also providing other business mentorship, about $300,000 in a convertible note from the venture capital syndicate that helps them succeed financially and remove those barriers. And as I said, we're really giving them priority access to the programming interfaces and the engineering team that's in my organization to help them succeed with those APIs and also influence how we develop those APIs for care or for those 4 vectors that we mentioned. Now, we pitched this to Todd. Todd actually was an inspiration for it last year when he came to New York and talked to us about freeing the data. We think of this as freeing the clinical data for the purposes of saving lives and providing better care. And when we came back this week and told Todd about the progress, Todd said, "This is great. This is a fantastic program. This is exactly what we want to see the world do." And we said, we think that we've got a handle on this. He said, I'd really, really appreciate it if you would consider opening up the program. I know you closed the doors for applications on Friday. Would you consider for the audience here today, for the people that are hearing this, to give it a little bit more time for some more applicants? I will tell you we've received several hundred applicants already, but for Todd, we're going to continue to have the application process open through Monday. As long as you use the secret code. Use the secret code, HDI, and put that in your application. And from that, we'll know that you were a participant here this week, that you're a friend of Todd, and now you'll be a friend of NICE. We're looking to have the finalists. These are the companies that the venture capitalists and the provider organizations think are really going to hit the mark. We're going to have them, 20 or so of those companies, come down to New York City and over the course of 2 days do their pitch to the audience of providers and VCs, and from that we'll do a selection and then start integrating the products into the Shiny and getting the ball rolling with the healthcare providers. The providers are extremely excited about being able to work directly with software developers, excited, motivated individuals who are going to really help them meet their needs. So thank you very much for your time. Hope you'll join us in this endeavor, and look forward to telling you about the great results later this year.
So, Dave, that was awesome, and I had a couple questions. One is, you do a great Todd Park imitation, by the way. You did that great. Second,
I could jump, but it really be painful.
Yes, we all should be doing more channeling Todd a little more. But I had a question. Do the investors take equity? Is there an equity stake that they take?
There's a small stake.
Okay.
Less than 5.
All right. And did I hear you right? Did you say that New York State is on track to eliminate fee-for-service?
That is true for our Medicaid population.
Medicaid population. Wow, that's amazing.
Which is a large population in New York.
That's wonderful. Yeah. Good. Thanks very much.
Thank you.
Congratulations.